project management is transferable, and it will open doors to places you don't expect. Council to NHS, NHS to banking, and then later retail, fintech, insurance. You just never know where this skill set will take you, and it's really exciting. Are you ready for the next part of my life story and my tale of a career in project management? Tough. In my last storytime video, I explained that I got my first project manager job working for Warsaw Council, and I found myself in a strange situation. I was expecting to be working with lots of dedicated project professionals. What I actually found was the backgrounds of nearly everyone in the team was from social care. They were all really dedicated to their profession and had built up years of experience in adult social care, understood the system really well and its flaws, and they really wanted to change those flaws and improve the lives of people who use those services on a day-to-day or occasional basis. I was one of very few people on the team with any kind of formal project management methodology, and I did my best to share the understanding with the team with mixed levels of success. This was also my first real encounter with regular team meetings. My God, social workers love their meetings. But we did make some big changes in how adult social care was delivered in the town, and it was a great experience. After nearly 2 years, I made the move across to the National Health Service with NHS Warwickshire to deliver a project on improving the patient experience in Warwickshire. This change in sectors wasn't a huge leap. It wasn't unusual to see people moving between NHS and councils and vice versa. This project was not a great success. I even made a video about it about a year ago about my regrets about how it ended. The short version is the government changed the way the NHS was structured and my project got cancelled. I did notice in this period that people working in local government tended to think that the people working in NHS somehow had it better. I think they assumed because of the greater budgets and investment that meant things would be done better there, with better access to tools and expertise and so on. But the interesting thing was the NHS staff thought the same about councils, so maybe the grass is always greener? After that, I did a contract running a very short project for the joint NHS and council unit at Worcestershire, which was setting up a pilot to try to identify previously undiagnosed dementia sufferers in care homes. The pilot was a success, but there were huge challenges in how we carried out the assessments due to the ethical considerations of testing people that may have a cognitive decline, or whose consent we need, or is testing going to needlessly distress somebody that is intending to help, and so on. So after the pilot was completed, there was no larger project to follow. However, I am pleased about the outcome of the pilot. As difficult as it was, I knew that anyone that did get identified would start to receive treatment sooner, and whilst there's no cure available, we could at least slow the progress of the disease and give that individual a better life for much longer, hopefully. And then things got turned up a notch for me. I joined NHS Direct, a call centre based healthcare provider spread across the UK at 30 different locations. The project was intended to replace the ageing telephony system with something more able to handle the challenges of the future and the change to what would later become the 111 service. Some notable things happened here though that really had a big impact on my future. One was that I met Sean Flynn, who years later recommended to me to set up a YouTube channel and share my insights via video. Good advice. It took a while, Sean, but I did listen. The next notable thing was the observation by my boss that the overall program needed more experienced hands and that I could benefit from a mentor. So he brought in Wayne Hunter Close, who did more in 12 months to level up my skills and understanding of project management than at any other point in my career. He had such a huge enthusiasm for project management, for delivery, and was an incredible mentor and remains a great friend to this day. Eventually, I got moved to a different project where I got to work more closely with Sean for a while, which was really good. But then as the project came to its end, I needed to find a new place to work. I just realised that made it sound like I got chased out of town after the project finished. It wasn't that bad. Like everyone else in my field, I looked at NHS jobs and opportunities with local councils. By this point, I'd already moved closer to London, so there were a lot more potential opportunities available. But one afternoon, I noticed that the Royal Bank of Scotland were in the news again. It had been a few years since they'd been rescued by the government bailout, and all of these bad practices that had taken place over the years were now emerging into the public view. I watched the news and I thought to myself, they need to change. They'll need project managers. I had some doubts about looking for a role with them as I'd never worked in banking before. But then I remembered I'd spent years working in healthcare, having never once done a first aid course. I also remembered that project management is a transferable skill, and that a project manager just needs to remember to apply the basics and have the willingness to learn in order to thrive in new environments. However, RBS weren't looking for project managers at the time, but they were looking for project assurance analysts. And the way they described the role was it involved shadowing project managers to see if they were achieving their deliverables in their plans, checking the plans to make sure they aren't changing without approvals, checking the risks are being managed, and so on. Less responsibility than a project manager, but paying over £10,000 more than I was on at the time. I applied, and on the basis that they needed new perspectives, new ideas, and a focus on best practice, I got the job. Whilst I worked my notice period at NHS, I was treated as though I'd performed some sort of minor miracle, as though nobody had ever gone from NHS to banking before. I doubt I was the first, but I was certainly treated as some sort of pioneer. But as I said, project management is transferable, and it will open doors to places you don't expect. Council to NHS, NHS to banking, and then later, retail, fintech, insurance. You just never know where this skill set will take you, and it's really exciting. So I joined the Royal Bank of Scotland as an assurance analyst, and that lasted for 2 weeks. And then everything changed again. But that's another story.